Around 50 million people suffer from dementia, also known as memory loss. This chronic and irreversible disease leads to poor quality of life, a high mortality rate, and increased healthcare costs in all countries. Age is the main risk factor, but other factors can also contribute to the onset of dementia at an earlier age. By 2050, it is estimated that more than 130 million people will be affected by dementia. The number of dementia cases is underreported, as symptoms usually develop slowly and gradually. Did you know that there are other factors that can cause dementia besides age? Some medications can cause dementia in younger patients. Watch this video to learn more about the medications that can cause early onset dementia. 7 drugs that can cause dementia. Number 1. Anticholinergics. Anticholinergic drugs are so named because they block the action of a neurotransmitter called acetylcholine, which is responsible for transmitting information from neurons to tissues, and vice versa. Anticholinergic drugs have a significant effect on the central nervous system, affecting memory, emotions, and body movement. They can also influence learning. Patients with Alzheimer's and other forms of dementia have lower levels of acetylcholine than healthy individuals. While it has not been proven that decreased acetylcholine causes dementia, anticholinergic drugs are used to treat irritable bowel syndrome, overactive bladder, antihistamines, antiallergics, and some anti-allergics. Their effects on the smooth muscles of the digestive and urinary tracts include muscle relaxation, pain reduction, and decreased urination. These drugs have many effects on the body. Diphenhydramine is an anti-allergic, as are chlorpheniramine and doxylamine. Hyoscine, trimebutine, and dicyclomine are medications for irritable bowel syndrome. Darafenicin, oxybutynin, tolterodine, and darafenicin are medications for overactive bladder. Scientists at the University of Nottingham in the UK conducted research showing a link between anticholinergic medication and dementia. The study collected data from approximately 300,000 people living in the UK between 2004 and 2016. The study found that anticholinergic medication increases the risk of dementia regardless of other factors. Anticholinergics increase the risk of dementia by nearly 50%, a higher percentage than any other medication. The study concluded that people over 55 who took anticholinergics daily for at least 3 years had a 50% higher risk of dementia than those who did not take this type of medication. Other risk factors were considered, and the impact of anticholinergics was clearly demonstrated. The study could not determine which anticholinergics were more harmful to memory loss. The risk increases equally in both sexes. Number 2. Gastric protectors. These medications include omeprazole, lansoprazole, pantoprazole, esomeprazole, rabeprazole, and dexlansoprazole. Proton pump inhibitors have been shown to contribute to the deposition of beta amyloid in the brain, the protein most strongly associated with Alzheimer's disease in humans. Proton pumps inhibit the absorption of vitamin B12 at the intestinal level, which is related to dementia. Number 3. Pain relievers. There are pain relievers of varying strength and mechanisms. However, it is surprising that some pain relievers can increase the risk of dementia. Opioid pain relievers, in particular, have a significant effect on the central nervous system, which can cause dependence, tolerance, or the need for higher doses. These drugs can negatively influence sleep, emotions, and mood. Prolonged use of these medications can lead to dementia. A similar relationship has also been attempted with non-steroidal anti-inflammatory drugs NSAIDs such as diclofenac and ibuprofen, but it has not been proven. Chronic pain can also affect the brain, predisposing it to memory disorders. There may be a combination of chronic pain and pain relievers with effects on the central nervous system that increase the risk of dementia. Among these are morphine, hydrocodone, hydromorphone, and fentanyl. Number 4. Benzodiazepines. Benzodiazepines, such as diazepam and lorazepam, are widely used worldwide. Prolonged use of benzodiazepines can cause memory loss in older people. Benzodiazepines can be used to treat insomnia, anxiety, and depression. However, they can cause other problems such as drowsiness and cognitive disorders. They also increase the risk of hip fractures and falls. A study by the University of Taiwan showed a 1.5 times greater risk of dementia in people who take these medications more than 365 times, or for more than 2 years, compared to those who do not take them. Number 5. Anticonvulsants. Anticonvulsant medications are prescribed to treat mood disorders, chronic neuropathic pain, bipolar disorder, and epilepsy. These include carbamazepine, also known as gabapentin, lamotrigine, also known as levetiracetam, oxcarbazepine, also called pregabalin, rufinamide, also known as oxcarbazepine, topiramate, also known as valproic, phenobarbital, and primidone. Anticonvulsants are believed to alter the ratio of neurotransmitters in the brain, such as norepinephrine and serotonin, which can have a significant impact on certain areas, causing changes in memory and even predisposing to dementia. Memory loss is related to changes in nerve impulse signaling in certain areas of the brain. There has been some debate about whether anti-epileptics alone can be a risk factor for Alzheimer's disease, as epilepsy is known to cause memory problems and neuronal damage. Number 6. Tricyclic antidepressants. The first antidepressants developed were tricyclic antidepressants. They work by reducing the amount of acetylcholine available in certain brain regions, which can increase the risk of memory loss and dementia. These medications can be used to treat depression, anxiety disorders, peripheral neuropathies, and obsessive-compulsive disorder. There are many newer antidepressants with fewer side effects, but tricyclics can be used for a long time, and some patients may benefit. Tricyclic antidepressants include amitriptyline, clomipramine, doxepin, imipramine, nortriptyline, protriptyline, and trimipramine. Number 7. Corticosteroids. Corticosteroids have been used for decades to treat inflammation. However, chronic use is associated with many cardiovascular, metabolic, and hormonal side effects. Oral or intravenous corticosteroids can cause memory loss due to changes in neurotransmitters and hormonal changes. Although corticosteroids can be used to treat many inflammatory conditions, their oral or topical use should be restricted. Corticosteroids include cortisone, hydrocortisone, prednisone, and hydrocortisone. The increase in life expectancy has led to a rise in dementia. Many studies have identified risk factors that we can control to decrease the likelihood of dementia. You should be aware of the medications that can increase the risk of developing dementia.